Now our speaker is Gerardo Sánchez. I will introduce Gerardo briefly. He is an environment and health expert at the European Environment Agency in Copenhagen. Sorry, I have to put my glasses, otherwise I don't see. His work focuses on the impacts of environmental and social determinants on health, the environmental burden of disease, and prevention policies. Prior to joining the European Environment Agency, he worked for the EIONET D2 Partnership, the World Health Organization, the World Bank, and the Massachusetts Department of Public Health. And you have been stationed in USA, Japan, Peru, and Germany. He was awarded a Fulbright grant, and he has a PhD in health economics and a master in public health. Gerardo will talk us about the European Environmental Agency and the lessons learned on translating research results into policy influence, lessons from the ground, as you put it. So, the floor is yours.
Thank you very much, and I'm very, very happy to be here. I first want to say thanks to Rita and to the Marco Polo colleagues for so kindly inviting me. I'm always happy to be among researchers. I did a bit of it myself, and I always find this is my crowd. So I'm going to say a few things of what we've learned over the years on some things that can be useful if you actually want to influence policy. A little bit of an art there, but you also have to be a little bit organized, because it's not about, my research is so good. It will have to be taken into account. Far from it. You need to make it count. First of all, just wanted to introduce the EEA. We are an independent EU agency, and I'd like to actually underscore that word, independent. That typically is very much liked when what we say aligns with some narratives. When it doesn't align, they don't like it so much. But alas, is our value added. So we stick to it. We stick to our guns. We're based in Copenhagen. It's a very beautiful building. We analyze and provide information on the environment. We're an interface between science and policy. Typically, if there's no other scientists at hand, we are the ones that will be asked about after the colleagues in the Commission, of course. And we depend upon strong networks to carry out our work. And this is also important because we are now 300, but for many years we've been less than 200, and you cannot cover all of the environmental scientific disciplines with that, right? We share an acronym with the economic area, but very little else. These are the countries in the EIONET network, and this is our superpower, the fact that it's not only us, but that there is well over 2,000, I think it's closer to 3,000 experts from all the countries in the EU and in the Western Balkans and in Turkey. And it includes 7 European topic centers, which are consortia of the best research institutions in Europe. The one we work the most with is the European Topic Center on Health and the Environment. So we work together with them, and a lot of the expertise that we can then accrue and capitalize in products comes also from them. So it's not only us. Now, we work with those European topic centers, which you can see there, and in groups in the EIONET network. So most relevant for this cluster would be the EIONET group on health and environment, and the thematic groups on air, noise, chemicals, as well as the EIONET group on climate change adaptation. So all of those deal with health impacts of environmental factors. We also host the European Climate and Health Observatory, which is not only the EEA, but many other institutions. And we all work together to inform policy and also to make all of these results useful to the countries, as well as helping the countries in implementing their own policies, so advising them on what the evidence is, right? Now, what recurring messages do we get from the countries on EU environmental policy. And I'm focusing more on the environmental one, but we also get messages evidently on the health one. So I'm going to actually echo Joachim on that. So most of the times we agree. Sometimes we don't. This time we do. We get this message that the policy framework is largely set. There's no appetite for additional large-scale regulations. And to be honest, maybe those new regulations are not necessary at this point. What's necessary is to implement what we have. Hopefully, we'll get more appetite for further advances later, right? Now, we are always told the same things about why is it that it's difficult implementing. Particularly at the subnational level, there is resources and capacity constraints, and this is where most of the implementation happens. So for instance, in Spain, most of the implementation would happen at the subnational level, and that is the case in many, many other places. But in some of those places where implementation has happened, there is a constraint in capacity and in resources, and the capacity part cannot be underestimated, so there really is a need there. It is also difficult to coordinate across governance levels, and so this is like in the practice, as in, you will actually call upon the regions and then 20% will not show up, right? So what do you do with that, right? I mean, you need to coordinate, you need to get things done, but that coordination in the practice is complicated. There is a complexity of the regulations. They're incredibly complex. I heard someone, actually an American lecturer, describing the European chemicals regulation as the most complex regulatory system in history. And that could actually well be true. I'm not familiar with it. And every time I try to understand it, I get a headache. So it's really, really complicated. And there is, of course, and it cannot be nice, a political backlash. And that comes from many different directions. Then integrating health and environment is in the practice also difficult. I mean, and I have to say, this is what I can say because we're independent, that we see a lot more engagement from environmental institutions in environment and health than from health institutions. That follows, of course, a trend of very little attention and funding for prevention. So the funding for prevention is minuscule, right? And it follows the attention of the health authorities. So how can environment and health research projects matter in policy in this context? Well, so, here's an example, right? This is a map on levels of lead in blood measured through human biomonitoring in Europe. So you see that there is areas that are well covered and others that are not. The gray areas may not care much about your results. So if your results cannot extend to there, or they don't see themselves in a map, many politicians may not care about it. I mean, this may sound absolutely obvious, but in the practice, what it means is that if you don't have a good coverage of the type of policy that you want to influence, then chances are you're not going to be listened to very much, right? Particularly if there's no new regulations or revisions of the regulations, and what you want is to act on implementation. So coverage is crucial. And to illustrate how crucial this is, for instance, we find at the EEA that it's a lot more useful for us maps that have been generated by a PhD student that cover the entire union with a clever machine learning system than super sophisticated multi-million projects that just cover a couple of areas. And this is a real case, as in like someone in his computer sending emails and making phone calls and putting together a model, and one map layer is way more useful for us than a lot of millions spent elsewhere. Now, those millions are well spent, don't get me wrong. They're just not very useful for the purposes that we require them, right? This is another example where being local also pays off. This is a simple product that we put together. It's called the European Environment and Health Atlas. And what we do is we get all the results where we have good coverage on noise, on air pollution, on water quality. We put them together so out there for the public. And it proved very, very useful with local and subnational authorities. In fact, we're seeing they are the major users, even though we're not thinking about them when we put it together. But they are using it a lot, and they are using it also as a one-stop shop. And now we actually have to start putting the data sets that we're using there, because it was not meant as a technical product. It was meant as a communication product, right? But now we're actually making the data accessible. And in that regard, it is a good showcase of research results where we can very directly, after a quality control, put them out there and make them accessible to a broad audience, right? So that is just one example of like coverage being useful also at the local level, right? Now, timeliness matters supremely when you're trying to influence any policy, whether it's at the implementation stage, where the agenda is being set, because as researchers, you typically will not have the ability to influence the policy at the beginning when it's being made, or like when the negotiations are happening, whether they are at the local level or the parliamentary level or the European level. You will not have the opportunities to actually influence those at any point. There will be a window of opportunity, or several, that you need to identify. So when you're following it, you need to identify when is it that is possible to influence that policy. And some of the influence could be very direct. You could just go and call Europarlamentarians. You can do that because you're researchers and project leads, and as scientists, you can do those things, right? So you can try and influence them. But if there's nothing like in the horizon that is going to affect that file, then chances are it's not going to be very effective. But if it's actually happening, or you know that it will happen, then you need to shoot not where the policy file is, but where it will be when your results are ready, right? So just like I don't shoot, but the people who shoot clay pigeons tell me you need to just move and then be ahead, right? And that's the same with your results. If they're not ready by the time that there's that window of opportunity, then they will not matter for that policy. They will not be counted, even though the quality of the research might be great and the results very relevant. So just think about that. As in, if you're thinking about results being ready and you want to influence policy, then you need to know that there will be a window of opportunity. These are some upcoming files of interest. Since we grew smarter about how to be better at these things, then we actually have colleagues whose job is to follow these files, and then for us to be able to plan, along with the colleagues in the Commission, Joachim, and the many other colleagues in DG Environment, to plan when these things should be ready so that we can make the evidence count. We, of course, have set products that they are counting on. So the Europe's Environment Report is coming up in days, or but also the Zero Pollution Monitoring Report. So Joachim mentioned something, and I'm sure many people here didn't perhaps pay much attention, which is that the results from this cluster could be taken into account in the Zero Pollution Monitoring Report. I mean, it's not a report that you want to miss. I think you want your results to be there, because that document is heavily used by many who have a hand in the policy levers. So I would say that if it's possible that some of your results are ready by then, you very much want those results to be in that report. So you should take up the word of Joachim at his word and try and actually put them in. Now, it's important also to use all chances. And sometimes, out of cynicism, some people may think, oh, what's the point, right? So recently there was a call for evidence on the EU cardiovascular health plan, which is coming up. It's very common. So the EU, as a transparent organization, puts them out and say, have your say, right? And then you may, well, there's a lot of like private individuals and a lot of interesting things being said. But when I hear sometimes researchers and national institutions, oh, isn't that a waste of time? I say, who doesn't think it's a waste of time? Lobbyists don't think it's a waste of time. They always comment on it, and their submissions typically are very well done, and they are supported by systematic reviews funded by them. And it's very well written, and it's all like very well thought out. And probably there were a few meetings on what do we write here, right? So it's not a waste of time for them. And I would say it's not a waste of time for a research cluster either. I would say it's a very good idea. Sometimes when something is written, the commission can't exactly completely ignore it. If it's written there many times, at least they'll have to acknowledge that this was said, right? And perhaps discuss the matter. So that's a lot more than one could have with a journal paper, maybe, even though I love them. So also, we haven't been doing a great job at the EEA of taking up research systematically. And that's why I was so happy also to be called upon with Rita, good friend of the house. And also I would say, and I'm not buttering you up, a good example of how to integrate projects so that they make sense and you can be more systematic. Because for now, the research that comes from these clusters and other EU-funded research may or may not reach the documents that we put together and the products we put together, or even EIONET. So typically it would depend on whether the scientific consortia we work with will pick them up in their systematic reviews that we commission for them. Some project leads, they reach to us directly to see if they can present the results to EIONET. And if we think that that's interesting enough, we'll say yes. But is that really fair to the other projects where probably some of the results are as interesting, but we just didn't hear about them, right? So that's something for us to think about. Sometimes we're invited to advisory boards. I'm part of 4, actually. But sometimes it's a little bit random how that happens, right? So you look at the project, maybe that's of interest, it's an area that is not well covered. So you say, okay, yes. But then, of course, that commitment limits the ability to support other projects. So the idea of liaising with an entire cluster so that if there's any value added to what we can say, the whole cluster can benefit, I think that's very good. But also so that we can just tell to EIONET, listen, there's an entire research cluster on health and environment. They'll present a snippet of the results to you, and you can follow up with them directly. I think that is the way to go. It's a lot more fair and it's more systematic. We also want for these projects to be policy relevant. So we want to teach what we learn about the interaction to these projects, and we also want to have a strategic approach. So we need to do our homework here, and being here, I think, is helping us a little bit. Using the One Health framework is a good idea to get political attention right now because there was a pandemic, there was a zoonosis, and then this concept that had been largely ignored for 4 decades suddenly became interesting again. So, it's not that I love this one particularly as opposed to planetary health or the exposome or anything, but this one is getting political attention, so you may want to use it. Also because it's still not clear what the environmental angle of One Health should be, and then many here say, what do you mean? There's a lot of research and everything. It's maybe clear in your mind, but it's not clear in the mind of people in high places. It's not clear that this should be anything more than human and veterinary medicine talking to each other. So maybe it's a good time to try and define a little bit what it means for your researchers and for environmentalists as well. So in summary, what I wanted to say is if you want to influence a certain set of policies, think about the specific level of governance and try and make it relevant there. That is locally tailored and has good coverage, always makes it more relevant. That the injection of evidence is timely, that it happens when it should happen, and by all channels available. I think that's a very, very good idea. I think it's good to speak with one voice in the things that matters, like as a whole cluster, we think these are the priorities. When I mean leaving the ivory tower, I mean just, even if it's a little bit painful, trying to simplify the messages to the point that that the lay language is understandable to everyone, right? So I know that that requires sacrifices, but it pays off if one does it consistently. And also that One Health is just not only a buzzword now, it's just actually to start to acquire meaning. And I think you want to be a part of that conversation. That's all I have for you today. Thanks for listening.